Welcome to Joe's Chronicles. Sorry for being away so long. So this video is called Choosing a Medical Specialty Part 1. Oh, and if you're wondering in my background why it looks like that, I'm actually recording at work. I have a little downtime, so I decided to record. Right, so choosing a medical specialty part 1. And I call it part 1 because I haven't chosen my specialty as yet. I'm in the process of choosing, let's say. But here are tips if you're confused like me or trying to come out of that state of confusion about choosing a medical specialty that you'd be doing for the rest of your life. Let's get started. So, tip 1, eliminate what you hate. Yes, eliminate what you hate. And you are going to use your internship experience in order to decide if you are going to delve in one of the four arms of medicine that we do here, well, especially in Jamaica, or you are going to eliminate all of them from your choosing or decision making process, like me. So, the four arms of medicine that you do during internship will be your general surgery, internal medicine, obstetrics and gynecology, and pediatrics. For me, all of it was eliminated, rotation by rotation. I was just like, okay, it's not for me, not for me. So all of them went into the no pile. Tip 2, use your second year of medicine as a medical practitioner. Here it is called a senior house officer. You are a fully licensed medical professional, and this is a time where you want to dabble in specialties that you may have an interest, and you're going to use this as a gauge to be able to choose later on. So the SHO year is divided into 3 blocks of 4 months each. I'm in my first block. In the first 2 months, I was placed back on general surgery. I know, not for me. The second half of the 4 block, I am on accident and emergency medicine. And so far, it is going awesome. I'm really enjoying it. It's so different than anything that you can really do in medicine. Stay tuned for more. During the SHO year, however, you want to have like your 3 boxes of decisions: your yes box, your no box, your maybe box. And during this year, and more so towards the end of the year, you'd be taking more of your maybe specialties and putting them in either yes or no category. So for me, at the end of my internship, I placed a lot, which was 4 specialties, into the no box. And even being back on general surgery, I realized no, it's staying in the no box. So during this SHO period, it's nice because you get to choose the specialties that you're interested in, and you get to have a feel of what it is like to actually work in those fields before you make that commitment for the rest of your life. Right? So that's 3.3. Sorry, I'm looking at my little notes here. Point 2. Point 3 now. Do not use medical school as a gauge or as a decision-making process as to which specialty you end up choosing. You as a medical student, your experience as a medical student, I should say, and your experience as a medical practitioner, working medical practitioner, to completely far remove things. Do not use that experience to make you make a life-changing long-term, it's like a marriage, life-changing long-term decision. Don't do it. Don't do it. It's really going to affect you negatively. Point 4, decide what you want in your personal life. So for me, I have 1, 2, 3, 4, 5, 6 things, maybe a seventh, that I decided that I wanted my personal life so that I can make a better decision when I have to choose a specialty. They would include, for me, family orientation. I am very family oriented. I am married, I have a son. So I do not want to, what can I say, put work in front of them and just be working all the time. Some specialties, that is what you need to give up that time. I am not willing to do that. 2, I want a balance between work and actually having an actual personal life, because it's very difficult to do in medicine, more so with some specialties than others. So right then and there, I know the specialties which go into my no box. There's a lot going into this no box for me. I want to enjoy my work. If you're gonna decide on a specialty that you're going to be spending 40, 50 years in, it should be something that you enjoy. Not every day is going to be great, but most days should be like, yes, this is what I want to do. I enjoy this. I love this. You know, next thing, I love to sleep at night. So that just crams a whole lot of specialties in that notebox. Yeah. I enjoy weekends. Again, notebox. I love traveling. Some specialties are much more demanding than others. How would they permit traveling in the time of your life that you want to travel? No box. Just put it in that no box. And after spending so much time in the hospital, I realized that I'm sick of seeing sick patients all the time. You know, sometimes you want to see somebody who actually comes to you in health. So I'm putting a lot of things from my baby box into my no box. Point or tip number 5, revisit all those biased specialties that you held during medical school. So remember I said previously that you don't use medical school as a gauge. Now, during medical school, you have certain bias against certain specialties. You do, because I do, or did. And I'm trying to break those bias now. And these are some specialties that I'm considering presently. They include being a GP. Now, I remember when I was on Com Health, me and my friend laughed. I was like, GP? Like, man, we want to be something cool. You know, we want to do cool stuff. No, we're just like, listen, GP life is where it's at. It is. The second specialty is opthal. Now, during medical school, I mean, you have to draw for some references, especially if you have none while you are working as a medical practitioner. My opthal experience was pretty wonderful. The residents were nice. They seemed really happy. They seemed to really enjoy their job. You know, they weren't as grumpy. I'm re-exploring ophthalmology. Third one I'm re-exploring is radiology. Boy, I did not get much experience in radiology, and my second choice For my SHO year, because we get to choose specialties that, we want to delve in a little bit, is radiology. So I really want to get that experience so I know, yes, I can do this. Definitely. I really want to engage in this specialty for the rest of my life. 4 is dermatology. I didn't like derm, but they all seemed really happy. They all seemed happy. To be honest, they did. And the 5th thing that I'm exploring, not no experience of it in medical school, is sports medicine, because as I said before, I want to deal with patients, or at least some patients, when, as they're healthy. I don't want to always be dealing with diabetes, the complications of diabetes, complications of hypertension, complications of renal failure. It's really depressing. It's really depressing. I would love to see the body in a nice, full functional state, and people coming, or patients coming to you for reasons other than complications of these lifestyle conditions. My 6th and final tip is to do emergency medicine for at least 2 months. For at least 2 months. It is so critical. It makes you a better doctor. It increases your ability to identify things, surely because you are seeing so many conditions on a daily basis. But it's like a GP on steroids, because a GP would also have to know about so many conditions. That's why it's called a general practitioner. You know, um, it's like a GP on steroids, because one, you're the first point of contact for these patients at the hospital. Two, you have to stabilize these patients. All of these are very adrenaline pumping things. They're different from patient to patient. Three, you have to do the basic investigations for the patient. And 4, you have to decide, is this patient going to be admitted, or do I send them home with follow-up to the nearest health center? So emergency medicine, if you want something exciting, if you want something that does not remain the same, if you want that touch and go, so you want to stabilize the patient and send them off, not having to really see them again, not in the capacity of a GP, whereas a GP will, they will do some of these things, but they have this long-term relationship with their patients. These are the things that you have to consider when you're choosing a specialty. And stay tuned for part 2 of choosing a medical specialty. I myself have not chosen, as you know, a medical specialty, and this might occur at the end of my SHO year, which is next year in 2022. So in between that time, I'll be shooting different videos, but stay tuned for part 2. Thank you for joining me. Please subscribe,